So let me speak about corrective orthodontics. So corrective orthodontics is something which covers mostly 60 or 70% of the whole treatment modalities what we generally do to correct the bad bites. Okay. So when we speak of corrective orthodontics, yes, when I can explain you about what are different approaches for malocclusions, generally it is about two ways. One is something called as comprehensive, other one is camouflage. Comprehensive is the way of approach is something like you treat the cause. Okay, so now we all know that when we speak of surgeries, not all of them, all the patients are prepared for surgeries. When we know that the problem is at the jaw level where surgeries are actually indicated, so patients either they are not ready for the surgery or they are worried about surgical procedures or even the consequences of it. I mean, obviously they wouldn't require or they wouldn't want the surgery to happen. In those cases, we wouldn't touch the problem. I mean, we won't touch to correct the jaw levels, but we will try to reduce the severity of the malocclusion. So this approach is called as camouflage. I mean, as the name suggests, camouflage is camouflaging the problem and making it appear much more aesthetic or much more acceptable. Okay. So obviously when you speak of corrective orthodontics, there are different modalities involved, there are different appliances involved, different techniques involved. All of these corrective procedures would require a means of attachment to the dentition or what we want to move. Basically, these appliances are devised to move the teeth in all three dimensions of space. So they can use different techniques again. There is something called as straightware technique, which is commonly called as straightware, other known as pre-adjusted edgewise appliance, or else which is a Beck's appliance or a Beck's technique, which is again a wonderful way of treating the cases which is not more extensively used nowadays. Or else you have self-ligating systems or ceramic systems, or much beyond that lingual braces too, in fact. So all of these things serve as an attachment onto the teeth, okay, either on the outside part of your teeth or the label surfaces, or else the inside part of the teeth, as we do in lingual orthodontics. These attachments which come onto the teeth are known as brackets. Okay, just like any other prescription, we have different prescriptions for these brackets. Okay, when we grossly look at the straightware technique or the pre-adjusted edgewise appliance, they come with different prescriptions. These prescriptions for an orthodontist is a means of language where the angulations which are built into the brackets that are explained. Okay, so basically these pre-adjusted edgewise, as the name suggests, the angulations by means of the slot design are built into the brackets. When we look at a teeth from a reference plane, each teeth will have a different angulation from that particular reference plane. So those angulations which are ideal are built into the bracket. Say generally in our language we call it as tip and the torque. In a gross sense, I can explain tip as the angulation of your crown part, whereas the torque is angulation of your root part. Okay. So this particular angulations which according to that particular author or one who has given the prescription is known as the prescription for that appliance. Say you have a Ross prescription, you have Alexander's principle, you have MBT. So there are a lot of prescriptions, just like these are the various sets of angulations for each and different teeth. Okay. So that combination of angulations for that particular teeth forms a prescription. So obviously not all the cases are same. So based on basically what we are dealing with, we select the prescription and go ahead with the appliance institution, in fact. So that makes sense. Basically this is a decision which is solely made by an orthodontist to use what prescription and how to go about it based on the requirement of the case, because obviously when we speak about angulations, either be tip or torque, that doesn't make any sense to the patient. What they want is straight teeth or good aligned or good aesthetic dentition. So this decision is purely made by an orthodontist. So when this is about the different modalities of the attachment what to speak about. Now attachment can extend from your anterior teeth, from the center teeth to the molars. The attachment can go up to your second molars too. Basically, second molar or the first molar act. This is the second molar or the first molar. Generally, they act. Either of them will act as a stop for the arch wire. Basically, so they get something called as buccal tubes. Okay, either they can be bondable, which is directly attached to the teeth, or else abandable ones. Okay, whereas other attachments on the rest of the teeth are called as brackets. These serve as an attachment to bring about or for us to express the forces in the way we want the teeth to move. Kind of.